Hi, I'm Dr. Tieche from Recharge Clinic, and I wanted to talk about some items that pertain to aesthetic procedures that our clinic does, as well as other clinics. The first thing I wanted to talk about are neuromodulators, and those things are things like Botox and Dysport. And what those things are used is to treat fine lines and facial muscles that are overactive. And I'm not going to go into a lot of that. I'm just going to show you some areas that we typically treat. We treat the scowl lines here. This is an area that's treated. We also treat the smile lines on the side of the cheek, and then around the corner of the eye. And then we also treat areas of lines in the forehead. We can also treat other areas around the corners of the mouth for what's called a downturn smile, and then the upper lip for both lip lines as well as a lip flip. Now, that's not what I wanted to really talk about today. I wanted to talk about expectations and problems from neuromodulators. So when we see a patient, particularly a first-time patient, we have to make an estimate about how much neuromodulators they're going to need. Because we all know everybody's different. Some require a lot of different things and some require much less. So we typically take an average and we take what we think is our best estimate and go ahead and treat them. Discuss that with the patient, find out about their budget, make sure that it's within their budget, and then try and treat those areas appropriately. What we usually do is then have that person come back in 2 weeks to reevaluate it. Some people are going to fall into different groups. Some are going to be completely treated where everything was perfect. We got it right out of the gate. Others, and this happens more commonly, are a little bit undertreated. And that's almost by design that we undertreat some people. Because really, if we overtreated everyone in the beginning, in other words, we had them be totally smooth, there's going to be a percentage of people who are going to be unhappy with that result. They don't like it. Secondly, it's a little bit cost ineffective to do that. What does that mean? Well, it's going to cost too much. We're just going to really overtreat people who didn't need that. So we err a little bit on the conservative side, and then once they come back after these medications, the Dysport and the Botox have fully worked, then we can reevaluate it and touch up other areas. Once someone's been an established patient, it's much easier to know how their muscles respond. Some people have very strong muscles. They require a little bit more. Some people have muscles that respond less, and it's easier to adjust it. So that's a big thing that a lot of people have concerns about when they're having their first time getting neuromodulators. And then we come back and what to expect and how is it going to turn out. And so we do that. I mean, it's sort of like going to a restaurant when you're hungry. You don't know how much food you're going to really need. So you don't order everything on the menu because you might only eat a portion of it, and that would be a waste. So we try to err on that. So it's basically trying to get what's best ultimately. So it may take 2 treatments. And when you think about that, that's not really a long period of time because ultimately these products last for more than 6 months. So we just try to adjust it in the beginning. Another issue that happens is once we kind of come up with an amount that we think they may need for this area or these areas, then trying to adjust that into the patient's budget. And what happens sometimes is we try to stretch areas. We try to treat really more areas than we probably ought to with a lesser amount to try and make that all work. What typically happens when we do that is it kind of gets a little bit less over treatment because we're really diluting it out a bit. And as long as we all know that that's potential, that's okay. Sometimes there's a misunderstanding and we say, well, we didn't get that great result. Well, we kind of didn't treat it as well as we ought to have as well. So neuromodulators work really well, but in the beginning it does take some adjusting, and really almost everything that people do in medicine is not always we know exactly the dose right at the beginning. And so that's why it's important and why when we treat people we have them come for follow-up so that we can fix whatever issues may be, if there are any. Most people are very happy at their follow-up, don't need anything, but sometimes we have to adjust things and tweak things to make that person happy and satisfied with that treatment.